Great. So, all right, well, we'll start off. I have my slide sharing here. What's an academic without his slides? I'm a core faculty member with the Sustainability Institute, as well as being part of the Infectious Disease Institute. And part of that is because a lot of what we do by way of how we build these models are a deeply collaborative arrangement. I need to make sure I'm on the right page. There we go. So in order for us to understand how we come about the recommendations that we make when we're looking at either multiple hazards, or in this case, only focusing and drilling down specifically on SARS-CoV-2, which causes COVID-19, we want to have a bit of an understanding of what the science entails for us to be able to do this. So what we do is we focus on the virus. And when I say we, it is a multi-institutional, multi-state set of teams that we put together to try and build these models and move them forward. So what we do is we focus on the virus. And in this case, the virus is emitted through your cough or your sneeze outward, kind of in a cone shape, as a droplet. And a droplet is an important characteristic because a droplet will fall out of the air at a quicker rate than something that will stay in the air and will actually circulate in the air for a longer period of time. So that's an important distinction when we make these kind of recommendations moving things forward. Surfaces are really important. If you touch a surface that's contaminated, now you've contaminated your hand, and now we have to deal with that contamination on your hand, and we'll see an example of that in a little bit. And then we have cross-contamination from you contaminating your hand and then contaminating other surfaces or other items along the way. So all of these different dynamics have to be looked at. And so what we want to do is we want to answer, what are the impacts to society that the virus is having? How do we eliminate or limit the impacts that those can be to the society? And in order to do that, we focus on the environment and the virus, because the environment is something that we can use to kill the virus. And if we can kill the virus, then it can't get inside of us. And if it can't get inside of us, it can't impact us. It can't create an infection. So that's what we want to try and do. We want to try and interrupt this that you're seeing here, the infection process. So the modeling that you've heard about before is trying to track and predict how the disease is going to move within a population. That's a much larger picture than what we do. We're getting down to the micro scale to be able to look at what's happening with the virus. So what we have is we have it where you cough, and then let's say that you forget to cough into your elbow like we always recommend that you do, or you're not wearing a mask. And so what happens is you either cough into your hand and now you have a contaminated hand, or you cough into the air and then it can land on the surface, or then you touch a surface. Once you've touched the surface, then somebody else can touch it, and you have inadvertently led to somebody's possible infection by not preventing this infection process from happening. And preventing the infection process is really quite simple. It is a matter of multiple parties working together in concert to be able to limit access of other people to the virus. If you can't contact the virus, it can't get inside you, and it wouldn't be able to create an infection. So it really is really quite simple. So this, in really simple case, infected person coughs, and then they're wearing a mask. If they wear a mask, the mask will capture a large number of those droplets. If you reduce the number of droplets that have viruses, that's even less than will get on a surface, and then they are eventually going to die on that surface, either by cleaning the surface, which is what the business owner or somebody else can do, or by you washing your hands before you touch a surface, or using hand sanitizer or something else to remove the virus before you touch a surface. Then that means that if the other person who touches the surface also then washes their hands before touching their face, then they're not going to become infected. So you can see where we can block this movement of the virus to create an infection at multiple locations by us as citizens and customers having our own agency and using our own agency of infection control to do so, and then also the business owner and operator being able to protect us and their staff at the same time. So it's really important. That's what we're trying to do, is we're trying to say, how do we model what these options are? Because what we can do is we can have a whole list of possible interventions that we could use. Some of them expensive, some of them very, very cheap. How do we choose one over the other? How do we then justify the choice that we have made? So the models that we develop are really targeted at how do you make these decisions under the uncertainty of something like a novel virus. And all a model is it's just math trying to play as the real world in a way. It is mathematics trying to represent the real world as closely as possible. And so what we want to do is we want to be able to say, once we have this model and we have a bank of them going forward, what do we say by way of, well, what if someone doesn't wear a mask? What if somebody doesn't wash their hands? What if we don't clean the shelves nightly? And what are these things that will happen if we're not taking our own personal responsibility and we're also taking our responsibility as business owners as well? So the main things that are really quite important, if you look to the right, those box plots, what those are showing is there's an opportunity for us to be able to, as business owners, to have a direct impact on whether or not people have a chance of getting sick. We can prevent a lot of infections by simply cleaning surfaces on a regular basis. What kind of regular basis does that mean? That's what some of our models are going to try and answer as soon as possible. What does this also mean by way of focusing on different types of surfaces? We can look at how often people touch those surfaces, what they're made of. So we've heard before that gyms are shut down because of how long SARS-CoV-2 lasts on stainless steel and other metals. Well, now that we know that, we can incorporate that into our models and say, do we need to clean them more frequently, or what do we have to do to be able to maintain an appropriately low level of viruses so that people don't get sick? And then what this means is, if we think about it in the concept of overlapping fields of control, we have our personal areas of control. I will wear a mask. I will wash my hands. I will make sure I don't touch my face. These are all behavioral actions that we can make a habitual practice in our own lives for us to be able to maintain our safety and our family's safety. And then the businesses can protect themselves, their staff, and us as customers by saying, well, this is what I can do. I can clean surfaces. I can make sure that I monitor my employees' health to make sure that they aren't sick and possibly spreading things around. We had the opportunity to heavily sterilize shelves at the end of the shift, things like that. Relatively simple things for us to be able to do that just have to become this habitual thing for us as the virus eventually does die away in the environment, but it will take time for that to happen. And then there are the building owners. What can they do? And that's more of an infrastructure question. Do they have the ability to alter the HVAC system? Do they have the ability to change out their filters on a more regular basis, put in thicker filters, make sure that the filters are HEPA filters? There are a number of options for you to be able to go through, but if you manage an infrastructure or you manage a building, for you to be able to say, I can have this now global effect on being able to help both the business owners and the customers at the same time. So it's really an idea of this is a team effort. It's Team Ohio, making sure that what we can do is protect ourselves, our families, and each other all in the same process. And our models are looking at that to be able to try and say, what are our best options in order to do this moving forward?
For those who cannot see this, I'm not sure this is showing up on TV. Do you want to describe this a little bit? In fact, I'll try to read it. Ceramic, plastic, stainless steel, wood combined. And
yep.
Then what are these, Doctor? What do these represent here then?
So on the X on the bottom axis, on the horizontal, you're seeing different surface types. So ceramic, like you would get on like countertops and things like that, or like sink surfaces, plastics, like bed rails and other items, stainless steel. Wood laminate would be things like table surfaces and other items like that.
Well, excuse me, Doctor, but I don't think they can read this, but on the side you have probability of infection. I assume that the higher this is, the more probability of infection. Is that?
Exactly, yeah. So you don't want that to be any higher than is reasonable. So what you're seeing there is all of those other than the plastics. In this simulation that we ran, there was a 1 in 10,000, actually less than a 1 in 10,000 chance that the majority of the population would run into by way of getting this particular infection. In this case, what we're showing is that plastics were, well, in a way, we found out two things in this case. Plastics are a little harder to clean, as well as you contact more plastic surfaces than non-plastic surfaces, depending on your environment that you're in. So that's just an example. And then combined is you don't just touch one surface in a given day, you touch multiple surfaces, and each one of those has a cumulative impact on the amount of viruses that gets on your hands and then eventually into you as well.
Doctor, I didn't understand. I didn't at least understand the 1 in 10,000. What I didn't get that at all. Sorry. You gave a statistic a minute ago. I don't understand what that pertains to.
So think of it as if there's 10,000 people, there would be one person that would possibly get the infection at that level. So if we did this for a building or a particular store, that store would have to have 10,000 people come through for a likely infection to occur. And again, when we say probability or likelihood, we're not saying that that is definitive. What we're saying is that there is a chance that an infection would occur.
Doctor, I apologize, but if what happens, I got the result, but what are we talking about? If such and such is done, if what is done, then we get down to those odds.
Yep. So this simulation was a person being in, and we actually built this for a hospital room, being in a hospital room for a day and a half or 2 days, depending on that span of time, touching different fomites and then touching their face and ingesting the pathogen that way.
But that assumes cleaning, though, right? Is that what you're saying?
Yeah, so there is intermittent cleaning happening as well. In this particular simulation, what we did have is we can start at different levels of contamination on the surfaces. So it can be you have one person, 5 people, or however many in the room, and they're all coughing and they're asymptomatic carriers. And we can start as like a worst case kind of scenario and then move backwards to just one person over the entirety of a shift and be able to look at the whole spread.
Okay. Doctor, I wonder if you could talk for us about masks and what kind of protection that gives, what kind of protection it doesn't give. Maybe when nobody has a mask, one person has a mask of 2 people, 2 people have masks. What kind of protection does that do? Or how would you describe that then?
Sure. So when it comes to these kind of interventions, it's best to think of it as multiple barriers or multiple shields. Just because you can get through one barrier doesn't mean that you'll get through other ones. And if one of those barriers doesn't work as effectively as you think it is or will, then there's other barriers to protect you along the way. And so if you are wearing a mask, you are protecting those people around you, and you're providing yourself an additional layer of protection as well. What the mask is made of will tell us what the level of protection is. So we have some research going on looking at different non-traditional mask material types, so comparing cloth to other options, and we're still gathering that data now on what the range of risk protections you get from them are. But we can look at each one of those materials. Now, if you on your own are the only person wearing a mask, you are protecting yourself. And if you are an asymptomatic carrier or you are mildly ill and don't even really know it, you're protecting other people around you at the same time by way of not expelling out those pathogens. Now, imagine if everyone in the store had a mask. If everyone in the store now has a mask, you now have everyone in the store providing their own shield of protection for their face, plus you have them protecting everyone else at the same time, being able to increase the overall level of support to the community. And then that's just one aspect of it. Add on top of that regular hand washing and controlling and thinking about whether or not you're touching your face or you're touching your phone, they're bringing it up to your face and so on. Like, if you think more about what actions you are doing, then you're going to be able to control your actions that little bit more. But in masks, when you're talking about it, you're talking about, I protect myself and my family and my neighbors. My neighbors protect themselves and their family and me at the same time. It really is a team sport.
Team sport. All right. Let's talk a moment, if I could ask you about distance apart and how that interplays with the mask. Dr. Acton has talked about Swiss cheese, where we lay one layer on top of another. Tell me about the spacing, how far people should be apart, and how a mask plays into all that.
So there's a lot of really interesting physics that goes into where we get those recommendations on how far apart for people to be, that I won't go into. But the basics of it are, if I tilt to the side a little bit, when I talk, there's a cone of projection that comes out from me. And you're going to hear that by way of the vibrations of my voice as they come out. That's how you're going to hear things. But also, there's a certain amount of particles, salivary particles and other aerosols that will come out from my mouth every time that I'm talking. And so what ends up happening is, whenever I talk, this happens, but I'm not talking with such force that it's going to eject out far distance away from me. But when I cough or when I sneeze, you are going to get a similar cone that occurs that comes outward from your mouth. And what's going to happen is that you're going to have those droplets spread through the air and then eventually fall out due to gravity, because some of them are heavy and some of them are lighter. The lighter ones will go a little bit farther afield from your mouth than the ones that are heavier, and those are going to deposit faster. So that's what we call droplet. So you're going to have these droplets that fall out from the air as they move forward. A lot of science has been done over decades looking at how aerosols, bioaerosols, so if you have an organism inside the aerosol, how they move around in the air and then eventually deposit. And what we've seen is that when you're talking about this kind of respiratory disease that you get which is COVID-19, you're ejecting out a pretty well-documented size range of aerosolized particles, and those are going to travel about 6 to 10 feet, depending on environmental conditions. And environmental conditions being, how warm is it, how cold is it, what's the humidity, air current flows, things like that, are all going to impact that. But the 6 to 10 feet, that's where that comes from, is decades of bioaerosol work, and it's still ongoing now through a number of different people trying to make sure we have the exact right values for SARS-CoV-2. So what that means is, even if you're wearing a mask, you really still want to keep that distance between people. Obviously, you're not going to be rude to each other, but you're going to make sure that you keep that distance so that you have this additional barrier, but it's not a silver bullet. It's not the thing that is definitely going to always work all the time. So it's an addition, again, like I said before, about multiple barriers, multiple layers. That distance between people is still going to be a barrier that we can use. Then we also have all the other barriers that we can put in place as well.
Eric, do you have the ability to put the doctor back on the screen, or try to get him back up? Doctor, can you switch back? So
sure. Take the slides off the screen?
Yeah.
Sure.
Unless you need that one.
No, we're good.
John, you have a question?
Sure. Thanks, Governor, Dr. Weir. Some of the interactions and discussions we've had, it's great to hear the science behind it. But as we're giving advice to people, because one of the things I've loved about our conversations, you talked about how an individual can empower themselves to solve, to reduce the risk for themselves and others. And as we try to simplify it, it's really distancing and masking it, meaning that we want to keep that 6 feet apart. We want to disinfect by washing our hands and washing down high-touch surfaces, and then we make that more effective when we put a mask on. Is that a simple guideline that we could give people to how they can think about it?
It's a really good set of simple solutions, and simple solutions are always the best because they can be followed most easily, and typically at very, very low cost. And it really does come to this idea that you have multiple layers of control, or you have multiple barriers, however you want to think about what we're talking about. But one of these on their own has its own level of effect. So washing your hands regularly, we've always been hearing about this, wash your hands regularly. That has its own level of effect that we know how much of the virus it will remove or kill in the process. And we can model that forward, and we do. But on top of that, you prevent its access to your face and your nasal passages in your mouth by an actual physical barrier. That's that extra layer of protection. And that's really where we get the most effect overall, is stacking these interventions on top of each other in a reasonable manner, so that we can get that. And that's going to allow us to be able to move around with more freedom, be able to make, get Ohio back working, but also maintain our safety at the same time. And it really is going to take the individual agency of each Ohioan to seriously consider themselves and their neighbors' health when they're making decisions and they're going about their daily lives.
Doctor, I wonder if you could give us some indication how long a virus will live. For example, I have a podium here made out of wood, on different surfaces. You had different surfaces up there before. Is there any rule of thumb? I mean, because this would go back to, how often would you recommend, wiping the surface off, sanitizing the surface? Any help for people who are watching you today, sitting at home, and want to have some guidelines there?
So the data that we have now, there's a concept called persistence. How long does a microorganism, in this case the virus, last on the surface? On its own, left alone, you don't do anything to it. It's going to die of its own life cycle because a virus doesn't last that long in the environment typically. So that's what you've been seeing. If you've seen any of the news reports or data that's been quoting that, it can stay viable in air. It's not that it suspends in the air for 3 hours, but it can stay in a relatively dry air environment for upwards of 3 hours. Some surfaces, it can last up to 72 hours, and so on. So plastics and stainless steels, it lasts the longest amount of time on. But that's persistence. That's if you don't do anything to the virus. If you take an EPA or CDC recommended disinfectant and you use that on the surface, whatever that rating is on the bottle, so if you turn the bottle around and you look at what's on it, if it says 99.9% or 2 log reduction, those are basically the same thing. What you're saying is it's going to remove 99.9% of the viruses, which means only 0.1% of whatever viruses were on that surface will be remaining if you use that wipe properly. So read the instructions on the wipes, wipe the surface down, and you're going to get that log reduction that's on that wipe if you follow the instructions. If you're using your own homemade approach to try and do that, maybe think a little bit more about using the recommended products. We recommend them for a reason, because we've tested to make sure that they actually do work on this particular virus. So that would be my main suggestion: is follow the instructions on whatever disinfectant you're using. Make sure that disinfectant is appropriate for SARS-CoV-2 or coronaviruses in general, and then just follow the instructions. Yeah.
Doctor, you and I and Fran had a discussion on the phone this morning about food. You want to relate what you told us about freezing, what you told us about cooking?
Yep. So when you freeze something, you damage cells. Most people who have tried to freeze fruit have been able to tell that, especially juicy kind of fruits. So when you damage a cell, it's no longer viable. Something similar is going to happen to viruses. You remove their ability to replicate, or you destroy another part of them in the freezing process. And the slow kind of bench freezers that we have at home are going to do more damage to cells than it's like a blast chiller or something like that. And so the freezing is going to have some level of an effect, but it's not the begin and end all. And in any time anybody talks to me about recommendations, I either go back to the history of time to start the explanation, or I make sure to talk about the uncertainties of it, because it's important to understand that it's a range of effects that we're talking about. There are no silver bullets. There are no sure fixes on things. It's consistency and persistence and vigilance. So freezing is going to have some level of an effect, but cooking is going to have even more of an effect. And there are decades of food science and food safety research that have been ongoing that have been able to show different levels of cooking have different effects on different cells. Viruses do not survive heat well at all. OSU is very lucky to have Dr. Kowalczyk in the food sciences office. She is world-renowned as a food safety expert. And as we think more and more about food safety and food risks related to this, which for a virus, if you cook it, are going to become minimized, I'm sure we'll be able to engage with her and use her expertise to a great degree. So, if questions come up in the future about food safety, I'm very confident that we've answered them to a great degree with research we've already done, and then we're in good hands in Ohio with the expertise we have.
I told Dr. Weir that Fran had some strawberries, and she picked some rhubarb, and she solved the problem very well, that she made a pie. So I thought that was a great a happy resolution for me. Doctor, I got one more question, then I'm going to turn it over to the news media here, see if they have any questions for you. Talk to us real quickly, if you could, about air conditioning, heat, and kind of how that works, and what should we know?
So air conditioning is basically, the simplest way of thinking of it is you take air from the room, you either remove energy from it or you put energy in. So if you're removing energy, you're cooling it down, and if you're putting energy in, you're heating it up. So heating systems will add heat to the air and then run it back to you, and then cooling systems will remove energy, remove heat from the air, and then run it back to you. That's how any of them work. But it's what's called a recirculation system. So your building or your room is going to have the air recirculating through it because it's more efficient to run it that way. It'll cost you less. It's more efficient from an energy and cost sustainability standpoint, and especially cost. It costs a lot less than constantly cooling down the outdoor air, especially in the summertime. But that recirculation means that you can recirculate the viruses as well. And again, we have many years of research that has gone into answering what are the ways of being able to mitigate bioaerosols or pathogens in indoor air, in room air. And again, simplest solutions are the ones that are usually the best. Filters do a very good job. The thicker the filter, typically we'll get more removal of viruses through that. A HEPA-rated filter means that it is a high-efficiency particle filter, so it's going to be able to remove very, very, very small particles, of which your bioaerosols are very, very small particles. And so the better the filter, the more protection you're going to have. On top of that, you have options to be able to change the mixture of indoor and outdoor air that you use. There's a bit of an energy and cost balance that you have to go through with that. These fall within that facility and building controls bubble that I had on there as well. And it does take a little bit more by way of analysis and thinking to see whether or not you can actually do these options. But that's that additional layer where the building owner, operator, or manager is going to be able to protect a large number of people. And so if you own a building and you decide that I'm going to increase the size and, if you can, the number of filters that are in my HVAC system, or you'll take another step forward and look at some of the air treatment technologies that have mixed efficiency, so make sure that you're choosing appropriately for your own system. So if you decide to take that step, you can be protecting hundreds of people or more in a day. And so that's that extra level of safety that, on top of all the things that everybody does on a daily basis to protect themselves and their neighbors, on top of everything else that the business owners are going to do to protect themselves, their staff, and their customers, it's just an even better, a better outcome if we can do that too.